we're hoping to make a 10 o'clock on the dot start. So if the broadcast could be ready to go on the dot, that'd be great. Thank you.
Okay, we'll start recording, please. And good morning, welcome everyone, and welcome to today's Health Scrutiny Committee. So I'd like to thank everyone for being here today with us. And to kick off the agenda, let's do the minutes of the last meeting held on 19th March 2024. Can I set the minutes to record? All okay for me to sign while I go away? Thank you very much. I shall sign those. On to item 2, which is apologies for absence. Catherine.
Chairman, I have apologies from Councillor Anderson for other reasons, and the substitute is Councillor Jono Lee. And I have apologies from Councillor Steve Carr for other reasons.
Great, thank you very much. And I know Callum's running a bit late, so he'll be with us shortly. So on to item 3, declaration of interest. If any council officer has any interest in the matter on the agenda, you should declare it now and state what type of interest it is and brief details.
My daughter, Chair, is a nurse.
Yep,
Thank you.
Yep, here we go.
Husband, student, community staff nurse.
Right, thank you. Is that all declarations? Yep, thank you very much. They're all recorded for the minutes. Right then, so onto the substantive agenda today. So, Newark Urgent Treatment Centre. I know it feels like this comes to us every month. It doesn't, but it's really important we brought this here today because it's about the implementation of the revised opening hours. So, first of all, I'd like to thank our colleagues from the HICB and Sherwood Forest Hospital Trust who did the briefings for members, the 2 briefings we had here in person and online, and to everyone who came along and to participate in those. And they were really useful, I found, to explain the rationale behind the change in the revised opening hours that we've obviously been talking about for a long time. So today we've got Lucy Darch, we've got Alex Ball and Dr. Steve Briggs from the ICB and Paul Robinson from the Sherwood Forest Hospital Trust. So thank you very much for coming and being with us today. I know it's probably not your second home here at County Hall at the minute, but we do much appreciate the time you've taken out of your day to come and speak to us today in terms of the Urgent Treatment Centre. So I think for anyone who's watching online, I know this is a very motor subject, especially in Newark, it's really important to say the decision has been taken by the NHS ICB in terms of changing the opening hours of the Urgent Treatment Centre, and the committee itself has met many times the last couple of years to talk about the proposals and to talk about the rationale behind any changes and why potentially needs to be changed. I know the committee has had a lot of input into the decision that's been made, and I do appreciate the way that feedback's been taken on HICB, and I think as we get into the proposals you can see the impact that members have had on that. It is worth saying the decision is taken already by HICB, it's going to be implemented. What we are here today is to scrutinise that decision, to put our comments in further, to ask questions on behalf of our residents of Nottinghamshire, and to make sure that the full facts are out there for residents. So we have 3 recommendations in front of us, and I'm going to change a bit around in terms of actually talking about that today for the recommendations themselves. So I know I usually come for it at the end, but I think it's really important to touch on the 3 recommendations in front of us before we get kicked off. So the 3 recommendations are that we note the briefing that we're going to have today, that we consider how best the committee can support communicating the permanent hours of the UTC and information about alternative local urgent emergency services available, and considers how and when it wishes to receive further updates on the implementation of revised opening times. So for myself, I think not to prejudge it because we're going to have the meeting here today. I think it's really important we do have an update come back, but we have to actually let the hours be open to look at the impact it's having on the community, rather than saying let's bring back a month after opening when we're not going to get any kind of meaningful data to show. So unless anything was to happen that would be out of the ordinary in the time to warrant that coming back, for me the proposal we're making at the end will be that we bring this back in 12 months' time, to after the implementation has gone in the summer, to look at how that impact has had on Newark and whether that's working or not, we feel, for residents, and to recommend any changes. So I think I'll formally move those recommendations at the start. Do I have a seconder?
Yeah, I'll second that. Thank you.
Thank you. So, save me waffling on any further, I can bring in our colleagues to bring the item there. So, Lucy, you kick off.
So thank you, Chair. And what we want to do is take you through some of the context and the process that we've used as a health system to reach the decision that the Chair has just outlined. So just by way of background, since March 2020, when the COVID pandemic hit, the urgent treatment centre within Newark Hospital has been open between the hours of 9 in the morning and 10 o'clock at night, with the last patient admitted at 9:30 p.m. These hours have been in place since that time, and the reason, I think, as we've described to you before, was that the impact of the COVID pandemic made it impossible to safely and sustainably staff the urgent treatment centre for longer hours than that. And you have been very, very accommodating in allowing us to come back to this committee with an update to those emergency measures, which lasted the duration of the pandemic and the subsequent recovery period. But we absolutely recognise that Newark residents need certainty of the future operating hours for the urgent treatment centre now we're out of the COVID recovery period. At the Scrutiny Committee meeting of the 20th of June, you did reiterate the importance of us arriving at a sustainable solution at the earliest opportunity, and I think Councillor Bailey was very clear in summarising that, and we understood and accepted that. And so we are here today to return with our finalised proposals. I think, as the Chair said, just to be clear, this has been an effort that has been jointly led and developed by colleagues in the Integrated Care Board, as well as those in Sherwood Forest Hospitals Trust. And we've worked really closely and intensively together to come up with a solution that is sustainable for the urgent treatment centre at Newark Hospital. Just to clarify, and I know we've done this before, the urgent treatment centre provides support for urgent care needs. So urgent care needs are those that are affect people with non-life-threatening illnesses or injuries, but they do need urgent attention. And as we've said before, the urgent treatment centre is one part of the NHS's urgent care offer, and that works alongside other services like NHS 111, pharmacy advice, and also out-of-hours general practice same-day appointments. Just to reiterate again, urgent care is distinct from emergency care, and emergency care involves immediately life-threatening illnesses or accidents which need immediate treatment from, for example, the ambulance service via 999. People suffering from those conditions will either be taken by ambulance or self-present to emergency departments. And again, as we've described before, to provide the necessary care for life-threatening emergencies, emergency departments, and this is national, not local policy, must be co-located on acute hospital sites with access to the appropriate life-sustaining supporting infrastructure, like critical care units, urgent diagnostics, that sort of thing. And for Newark residents, the nearest emergency department is at Kingsmill Hospital. And I think, as we probably said before, emergency departments typically support a population of about £1 million. They need to be at that scale to be safe and sustainable. So that's just, a restatement of the background. When we last came in June, we said we were going to go through a process to reach a decision about the opening hours, and I'm just going to go through how we've done that. So we came in June, but in the autumn we ran an extensive listening exercise, and we heard from nearly 2,000 people. We held 6 public meetings, and a combination of in-person, online. We ran a survey. We undertook media briefings, and we had lots more interactions with our communities and their representatives. So that was our listening process. We also asked the NHS East Midlands Clinical Senate to advise us. And the Clinical Senate is an independent panel of doctors, nurses, patient advocates, and other healthcare experts who have given us a report on their views of the urgent treatment centres opening hours, and they look at the national context and the local context. And it's just worth reaffirming that the Clinical Senate, and again, this is a national process, we work with the East Midlands Clinical Senate, is an independent panel, and they are brought in when we are considering complex issues like this, so as to ensure that we get the best advice, and that advice on how we configure our services is not unduly influenced by local pressures in the health system. So they are an independent panel. So we listened to people, we took independent clinical advice from the Clinical Senate, but we also conducted an externally facilitated, so somebody who coordinated an options appraisal. And that options appraisal process was industry standard, very thorough, and we had input from our local clinical experts, our operational managers and clinical staff, representatives of the community, and also the independent governors from Sherwood Forest Hospitals Trust. So that was us bringing our local people together within a very formalised options appraisal process. So we considered a range of options. We considered 11 options actually, and we went through a process that was individually validated, taking each of those options and applying a series of decision-making criteria. And that options appraisal narrowed us down to a number of options that were considered by the Integrated Care Board on the 14th of March. And just to remind you, the Integrated Care Board is the body with the ultimate decision-making authority in relation to how we determine healthcare needs for our population, how we plan our services accordingly, and also how we best allocate our human and financial resources. So that is the decision. They took the decision in March. So, apologies. The next slide. So just to conclude, to provide a sustainable, high-quality urgent care service in Newark for our residents, the Integrated Care Board has approved plans to extend the opening hours at the Urgent Treatment Centre on a permanent basis in relation to those hours that were agreed in March 2020. It has been concluded that the Urgent Treatment Centre will open between 8 a.m. in the morning and 10:30 p.m. at night, with the last patient admitted at 9:30 p.m, and that those hours will operate 7 days a week. And this will offer an extended window for patients to access essential healthcare services. We anticipate that the new hours will be mobilised from this summer, from summer 2024. So, just to confirm, that is 14 and a half hours a day, and that is greater than the 12-hour minimum national standard for urgent treatment centres set by NHS England, and also longer than the current temporary operating hours. We hope and we believe that the new operating hours will enable an earlier opening and a longer time for us to help people who need to access urgent care, and that particularly the earlier opening will support people around working patterns and school times. To reiterate that this decision was informed by an independent review carried out by the East Midlands Clinical Senate and the local options appraisal process, which included feedback from local residents and stakeholders. We trust that the new opening hours will strike a balance between flexibility for the local population. We've looked at current service usage. Obviously, this has been a very data-informed decision. And we've also looked at the practical operational and staffing arrangements to make sure that we have the best and most sustainable staffing arrangements to support those opening hours. And it's important to note that staff working in the Urgent Treatment Centre have been actively engaged as part of the conversations about the service. And they have welcomed the clarity and certainty that the decision on the centre's permanent opening hours has brought. So finally from me really, we believe we've listened extensively to the population of Newark, and we do believe that patients, members of the public and other stakeholders have been given the opportunity to feedback and inform our decisions. We have taken legal advice on the requirement for statutory consultation with regard to service change And please be assured that the ICB does take its statutory duties extremely seriously. And based on the legal advice, as well as guidance from our regulator, which is NHS England, the ICB is satisfied that the proposed changing open hours does not give rise to the type of process that requires or indeed benefits from public consultation. And we have taken this decision based on a significant body of evidence gathered on the impact on population health needs and, importantly, access to services. So we won't be holding a formal public consultation on the new opening hours, but we do very significantly intend to remain open to feedback on these opening hours, including through your committee and our own processes. And please be assured that we are open to hearing anything that is material if the impacts are not as we anticipated. And we will work with you over the coming months and years to make any amendments as needed. Thank you.
Thank you. Thank you, Lucy. So just a couple more bits, Chair. So as we've said, we're intending to implement these new hours from this summer. And as part of that, one of the things that we learned during our extensive listening exercise, that there is definitely some confusion amongst residents in Newark around how and when and where they access services for both emergency and urgent care needs. So we are planning a communications campaign starting just before those new hours and kind of running beyond that throughout the balance of the year, to really give really clear information about what these new opening hours are, how citizens can access their urgent care needs, their emergency care needs, and what the options are for people to be able to do that. You can see laid out on the slide here some of the ways that we're intending to do that, taking on board feedback from colleagues both here and elsewhere, a really good balance between online and offline activities. So there will be materials going through the door of everyone that lives in Newark, telling them about the new opening hours and promoting the ways they can access urgent and emergency care. We'll be popping up on bus stops, we'll be in the Newark Advertiser, and we'll be doing stuff digitally as well, in GP practices, on our websites, advertising on social media. And also, we'd be really keen to hear from you about how you can help with that, working with community groups that you interact with, working with your constituents and residents to really help us, as I think I've said before, share the facts here. That's the important thing, isn't it? Because the last thing we want anyone to be in a position, if they are in need of urgent care or indeed emergency care, to be unclear about what the situation is and waste any time accessing the care that they need. So just final slides, please. Obviously, the Chair and Vice Chair have proposed and seconded a number of recommendations. As part of that discussion, it will be really helpful to understand how you might be able to help us to communicate those new permanent opening hours to the residents of Newark, and also how you would like to receive those further updates about the implementation of this. We've heard a suggestion of 12 months, which seems really sensible. It'll be good to understand what you would like that to look like and how we can help keep the committee up to date and informed. Thank you.
No, that's great. Thank you very much for the presentation. And I think what's really key to me is the certainty for people in Newark and the surrounding areas, because we've got to be absolutely certain when decisions are made, and it's about how that is communicated to residents, as you already said, so they absolutely know where they can get the treatment they need. Because I know there is confusion out there in terms of, and that's not just Newark, elsewhere, in terms of doing 111 to go to GP, to urgent treatment centre, A&E, etc. So it's really important that we get this full facts out there. One thing I just want to say to the committee before I start, which I should have said at the start, was we are in the pre-election period for PERDA, for the mayoral elections and for the PCC elections. So I know the committee is very good in keeping the politics out of it and just talk about the facts, but I do have to put that on the record before I get struck down by the monitoring officer. So just please bear that in mind. If it does get straight into that political territory, we'll have to adjourn the meeting. For me, Alex, before I open up the floor, is this is also the members of the press who are watching. Obviously, we're saying it's summer 2024. I think there is confusion. Some people think these hours have already started. So I think for any members of the press who are perhaps watching online and reporting this, just please not mind any reporting you do. It's not really there yet, because us we want people to be turning up at 8 in the morning thinking it's already open. And I'd just say about clarity for that, maybe in terms of posts you're doing at the moment, etc. The next few weeks, just to be absolutely certain it's not there yet, because I can see why. If you're having a quick glance at it, you would just think maybe it's open now. We're obviously in the detail, we're so close to it, we know it. But I imagine if you are Joe Park, you might not. In terms of the communication, in terms of the hours itself as well, as I say, I've been made aware by a couple of local members in Newark. Again, people are still turning up at different times and for what is there. So I think just in terms of that reporting going out there and what we can do as members just to make sure the public know, as I say at the minute, where they should be going in the interim. So what the points you made out, I think, are really key about the communication side. I think what you've suggested in terms of the presentation there does sound like it hits down the head for me in terms of communication out there, but I think also that wider about just make sure they know where to get that treatment, like I say, at any time, because the GPs in Newark who are now able to do certain services with the 1-1 service, etc., just to know it's not just the urgent treatment centre. And also, I think it's been alluded before, if it's an emergency, that's not the urgent treatment centre, that's Kingsmill or QMC or wherever else. That just needs to sort of be made absolutely clear out there. So before I walk on any further, I'll open up to the floor. So I think first of all, got Councillor Martin.
Yeah, thank you, Chair. I welcome you all this morning, and nothing that I say is a reflection on anything you do, because it's a bigger picture. And if I go back 12 years, the reason that the people of Newark today will certainly feel let down is because we've gone from a full A&E at Newark, or an A&E department at Newark, to 24-hour urgent treatment care centre, down to 14 hours a day. And I think it's the reversal of a path. When we talk about the population of Newark being 30,000 and a planned expansion of 10,000 properties in the immediate vicinity, and this is beyond your remit, Lucy, because it's lack of government funding. I'll use the word government, not governments, because that's that's the issue here. Because I think that we're going the wrong way with it. I also understand that in the same time frame that the actual rationale of an A&E has changed. And that is something that will be beyond public perception if it's not communicated correctly. And it's always been about communication, as Alex knows. We've talked about it in the past. We've still got signage up around Newark pointing you to an A&E, and that's something that has to be resolved. I don't believe that the public will ever probably engage in a public consultation with the NHS again, because they feel that they haven't been listened to. I know that from Councillor Debbie Darby, who's the County Councillor for Bridgeward, which is just down the road from Newark Hospital, and they just feel like they've had their services removed. Now, we've had reports in this committee of the excellence of EMAS to deliver people to Kingsmill, and we know Kingsmill have turned it round. It's a really good hospital. Thank you, Paul, for that, turning it round. And you won an award the other week, didn't you, for that? Yeah. So I think the service is going great and it's in the right place. I'm amazingly surprised, like I was the other week, about the delivery time of people from Ashfield and Newark and Sherwood being almost on par by EMAS. So that's not an issue, but it's the change in service and that feeling from the people in the outlying, because there's a lot of satellite outlying villages around Newark, with a lot of elderly population in, obviously 25% more than it was 5 years ago. And it's those people who remember that there was an A&E, and it's hard to let go of that perception. And we've talked about communication, and communication is key, but they will feel, especially now you're not going to do a public consultation, and I know why you're not going to do a public consultation, because they would always want more would always want more, but they do feel that they haven't been listened to, and that's the thing that you've got to get across to them. On your statistics, it probably shows that people only come between 8 and 10, and that's that. So, in reality, what you're delivering them is probably what's adequately needed, but they won't feel that at all. They'll feel like you've removed it. And I know once they get to A&E, you've got a plethora of other services that could never be provided at Newark. But in 2019, the government said they were going to build 40 hospitals. I don't think they've even built 3. So it's all about money, and I think we ought to be honest about that. I really do, because it is about money, and I just think they've been presented with a fait accompli, really, because it was already going down that route anyway, and I think that's why they might think they haven't been listened to. Thank you, Chair.
Councillor, before I bring in colleagues, just want to say about the signage issue you raised. So it was raised by Councillor Pringle at one of the briefing sessions we had, and I went to local members to ask them if they knew of any signage to raise it through highways. I spoke to Louise as well, the Newark Fire member. So the signage we've identified so far says not A&E. That's all the ones we've seen, so not actually saying A&E this way. So if anyone does know of any signage out in Newark area that still says A&E towards Newark Hostel, please do let me know or go straight to Via, because they will change that. But the signs we've seen so far actually say, but again, at first glance, it looks like A&E. When you actually look at it, it says not A&E. So it's kind of you have to look at it twice. But I get why it's been done that way. But just to, and again, for anyone watching well from Newark, if you are aware of those signage, please do let us know, and we'll get that changed. But it's one which we are very much on top of, and thanks Alex as well, who offered to help with that in terms of communication point of view as well. So I just want to get that on the record what we are doing about that to make sure it's clear. So Lucy, do you want to come in?
Yeah, just firstly, thank you, Councillor Martin, for your response. I think that was very thorough, and certainly your comments about the way health services have developed. We do recognise, and I think perhaps Dr. Briggs might comment, that the way emergency care has been provided has changed. You know, healthcare policy and delivering of emergency care has changed over the past 15 and 20 years. And we can do things now that when Newark had an urgent emergency department we couldn't do. You know, services, you know, heart attack, direct intervention that provided from the city hospital. So it is a changing context, and emergency care has changed, but so has urgent care. I think I absolutely recognise your comments. We will not be conducting a statutory public consultation. That is a very particular process. But we have listened, and we have genuinely listened. I can tell you that we have listened, and hopefully the extension of the opening hours does reflect the fact that we have listened, and we will continue to listen, and that's what we want to put our efforts into doing. When we've come to the committee before, I mean, I've been around in this system for quite some time now. And I go back to probably 2012, 2013, when it was fair to say that we weren't clear about what services, beyond urgent treatment centres, the urgent treatment centre, what services were provided from Newark. And I think working with Paul's colleagues, A, those services have been expanded, and B, we've tried to help the public understand what they are, how they access them, and certainly their input has helped us make them better. So I sort of, you know, accept your comments. I think, Dave, if you want to just pick up on and we need to keep communicating, because urgent care and emergency care will keep developing, and we will keep changing our services to reflect that.
Yes, so there was a national review of emergency care services, which on the background that the England-based review was a significant outlier in Europe for outcomes, particularly around cardiovascular events, but also some sepsis as well. And as a result of that, the sorts of interventions that were required to deal with that, which was primary widening of the vessel of the heart, and more latterly intervention in strokes by removing clots, had to be done at a smaller number of centres with access to other services. So at that time, those services went through a process to ensure they were fit for purpose and could deliver those outcomes, had enough volume of activity coming through to keep the skilled members of the staff up, but also enough services. So that essentially rendered a number of services that would not and could never deliver those combinations of those services. And the good news is those outcomes have substantially improved compared to where we were. We still got work to do on that, which is why it's important that we still communicate the difference between urgent care and emergency care. So we still got work to do around sepsis. So people have got signs of symptom sepsis and phone 111, and they meet the threshold. They should still go to an emergency department, not an urgent treatment centre, because the management of that could never be delivered in a small unit. So still work to do, still communication to do, but outcomes have improved with that change in service.
Chairman, thank you. As the only Newark elected councillor here, I'll tell you about Newark. I won't have somebody that doesn't live in Newark. But it was really interesting that you said the services being rolled out to Newark is probably deserved. No, it's not deserved. The service in Newark is rubbish, let's be honest. The urgent care is predominantly used as a doctor's surgery because people can't get doctor's appointments. That's what it's predominantly used for. If you have an emergency and you need to get to an A&E, there's a 45-minute gauntlet you've got to drive to Mansfield on a road that isn't suitable. Let's be clear with that. Is the truth of the matter is, if you have an urgent issue, and I've had a few over the years with my little boy and my wife, where I've had to get them to hospital because there's been a 2-hour wait for an ambulance to get to the house because it isn't deemed urgent enough. The services isn't good enough. The reason you're not doing a public consultation is you know what the answer is going to be. The people in Newark want an A&E. That's what they want. And the reason you're not doing a consultation is you know that's what they're going to say. Because that's why you're not asking them. So let's be honest, you can sit here as much as you want and say, no, we're doing this and we've listened. You've not listened, because the residents of Newark will tell you two things. They want more doctors' surgery, something that the district councils could do if you were to ask for them, but you're not asking for them because you can't man them, because you want to pull all your resources into the facilities you've got. That's the fact. And then the second fact is you want to do the same with your hospitals. You want to pull all the services into key areas. You don't. In an ideal situation, I wouldn't be surprised if you wouldn't secretly want to close Newark if you had the option to do so. Because the truth of the matter is, you would fund it properly, you'd manage it properly. Yes, it's shocking, isn't it? Because my residents are shocked that they've gone from having an A&E system to now having predominantly a doctor's surgery, because that's what it is. Because everybody uses Newark A&E as a doctor's surgery. You speak to the doctors there. I was there last weekend. It's used as a doctor's surgery because people can't get doctor's appointments. You ring 101. You have to go to Newark Newark Urgent Care, and wait for an appointment for 2 hours for an emergency because people can't get doctor's surgery. People in Newark want an A&E. You know that. I know that. That's the truth of the fact. That's why you won't do a consultation. I would actually dare you, challenge you to actually do a public consultation, listen to the residents of Newark, and actually listen to what they want. Because you and I all know it's an A&E. That's what they want. And I would challenge you to live in Newark and have an urgent issue and need to make the 45-minute drive to Mansfield. I'd actually challenge you to it because I've done it twice and it's scary. It is actually scary having somebody that you love and care for, not knowing if you're going to be able to get them there in time. Because the truth of the matter is I would love to see the statistics of what the life expectancy is for an urgent issue if you live in Mansfield and live in Newark. I'd love to see them statistics. Because the truth of the matter is, I would guess, and I'm not a professional, I'd guess that you've probably got a better chance of surviving if you live in Mansfield next to the hospital than you live in Newark and you've got to drive after 10 o'clock. And the reason I'm saying this is I am being quite blunt here, because I've received these concerns and comments from my residents for the past 4 years. And I get blamed for it as an elected member. The truth of the matter is the decision is made by you. It's not made by me. And I'm the one who's had an 8-year-old that I've had to go to try and get a doctor's appointment and not being able to get one. And then had to go to the urgent care in Newark and be told, oh yeah, there's not much we can do, you need to go to King's Mill. It's not on. It's not on in this day and age that the people in Newark, and I represent 10,000 people, let's be clear, I represent a quarter of Newark. I represent 10,000 people. And my residents in Fernwood, in Newark, in Middlebeck, in Connington, want an A&E. They don't want it closed at 10 o'clock. They don't want the roulette driving to Mansfield at 12 o'clock at night, thinking, am I going to get there before my loved one dies? And the truth of the matter is, they're not professionals like you. They don't know if what their loved ones have will kill them. All they know is they have to get them to hospital. And it's not good enough in this day and age. And if Mansfield closed, and as you know, Mansfield closed its doors last week because it had an emergency on, the next closest hospital to that is City or Lincoln. That's even further away. You need to have a look at bringing true services to the residents of Newark. True services. You need to bring proper doctor's surgeries back to Newark so people can get doctor's appointments, and then bring an A&E back. And anything less to my residents is not going to be good enough. Thank you, Chairman.
I mean, Gusty, I understand how passionate the subject it is in Newark, especially the residents you represent there. I think it's worth saying, there's absolutely no plans to close Newark Hospital. I'm sure colleagues will come in there and say it now. And I understand, especially with information that's gone around in Newark and trying to talk about what's gone on today. I mean, I'll let colleagues come in first, actually, because you've already covered a lot of points better than I will, and I'll come back at the end just to, if there's anything else to cover off. So, Lucy.
Yes, so speaking on behalf of the ICB, who is responsible for identifying healthcare need, and it's what healthcare people need, which isn't always what we want, but it is what we need, and planning services and allocating resources accordingly, I can tell you absolutely categorically on the record we do not want to close Newark Hospital. I've been here before and I've said it before under other agenda items. Newark Hospital is one of the jewels in our crown. It offers services that are unique to Newark and that Newark residents benefit from in terms of their close proximity to where they live. And there is no intention to close Newark Hospital. In fact, we want to grow Newark Hospital. We benefit, and Paul can talk far more eloquently than I about this, but I did work for the Trust. We benefit hugely from actually the involvement of the local population as both volunteers and also staff in Newark Hospital. So there is no intention to close Newark Hospital. I just would want to say that. And we will grow services in Newark Hospital where there is a need, and we will continue to do that. So I just want to assure you of that. That's not to say that we don't hear, and we do hear, what the residents need, feel they want. But I can absolutely categorically say that we are not choosing not to consult because we know the answer is to open an ED. We're choosing not to consult because we are wanting to engage with our population on how we best provide the services that we can and that improve their health the most. But I do absolutely respect your passion for your population, and that's why we're here. That's why we want to talk to you. That's why we benefit from engaging with people like you. A couple of things I was going to say. I can say, with a degree of certainty, we have done quite a lot of statistical analysis around mortality data, and we've taken that down to what is called lower super output area level, so postcode level, about people's mortality data in terms of where they live in all of the rural postcodes surrounding Newark, and we have demonstrated over a period of time that with the services that are in place to support people, yes, you are right, they have to travel further, but with the ambulance service that can offer immediate life-saving care, that people's life expectancy in Newark is not diminished by its lack of proximity to an emergency department. But I absolutely get that however we nationally and locally, however we locate our emergency departments, some people will be closer, some people will be further away, but there's no evidence to say that being further away with the services in place that wrap around, that mortality is greater. Just finally, I would say your comments about general practice, and again, I don't know whether Dave would want to come in on that. Our GPs work incredibly hard. They see 70, 80, typically a GP will have 70, 80 patient contacts a day. They're dealing with everything from young children to people at the end of their life. They do work incredibly hard. They provide the care that they can in the hours that they can, but out of hours there are other services to support them, and certain things like injuries that need an urgent but not emergency response. It's not right for GPs to attend to, and they are the kinds of patients that will go to somewhere like the Newark Urgent Treatment Centre. So I think, probably picking up on Councillor Martin's comment, it's a complex pattern of services we offer. You've got GPs, you've got urgent treatment centres, you've got emergency departments, you've got pharmacies, you've got 111, and we've got out of hours GPs, and it all has to work together. But I do hear what you say, Councillor Lee, and thank you for sharing your views. I don't know, sorry, yeah.
Yes, so just on primary care access, which is one of our priorities as an ICB, I think we recognise that the population would like more access than they currently are able to access, not just in Newark, but actually across the city and the county. We've got a fairly comprehensive plan about how we propose to do that, which we're partially through implementing. One is improved telephony services, so the not being able to get through to an engaged surgery becomes a thing of the past, and we're pretty close to completing that. It also allows us to understand how many people are requesting things as well. The second is an increased number of appointments, and the number of appointments in Notts and Nottinghamshire has gone up by 7% since we started this work. The third is increasing alternatives to general practice for common conditions, and the Pharmacy First has gone live. We've got a very good uptake from our local pharmacists to do that. We're also looking at opening up the NHS app functionality, which we know will appeal to everyone, but will, to a significant number, allow you to take better control of your condition. We've got a 98% sign-up rate by practice to the NHS app usage, and we're looking at how we can extend that further. And also we're looking for those practices struggling the most. There's a comprehensive support mechanism to see how they can organise their businesses in a way that improves access. So is it improving? Yes. Is it where we want it to be? No. Our GP's working really hard, yes, but I think there's some more scope we can do in terms of improving that in the near future to improve it. And in Newark, the number of appointments meets that of the rest of the ICB in terms of improvement, which is about 7%. But the GPs in Newark recognise they'd want to do more for their population and are looking at how they can do that, but recognise the challenges they've got with their workforce.
Yeah, if I can just come in and talk about Sherwood Forest Hospital's commitment to Newark Hospital, which was Councillor Lee's part of Councillor Lee's question. The board of Sherwood Forest is completely committed to sustaining the services at Newark. In fact, over the last 2 years, we've expanded the range of services. We've built a new theatre suite. We've reopened Castle Ward. There's an increased number of diagnostics and indeed procedures being undertaken on the hospital side. And we've got a new car park ready to go. So to fulfil the needs of people accessing, because we know that more people will be accessing the hospital site over the coming years. So I think that demonstrates the where Sherwood Forest Hospital is, and we understand that Newark Hospital is, as Lucy said, sort of the jewel in the crown. It's something that the community really supports really well, and the vast majority of staff who work in Newark Hospital live in and around the Newark area and really contribute to that sustainability and that increasing range of services that are now being provided. So we'll continue to do that. Thank you.
Yeah, no, thank you for that. I'm sure I've come back in. I think there was some. I think it was quite interesting on the briefings. I know that wasn't the public domain, but I think it was Ben presenting on the briefings there about the A&E definition has changed, obviously, and in terms of it's not the case of just saying there's now an A&E here. There'd be a substantial amount of not only building work, but in terms of the extra staffing you need in terms of consultants, doctors, and beds. We're talking tens of millions of pounds. I'm saying, tell me at any point I'm wrong here, any figure or in there, because I think it's worth just saying on the record. Coming in, members are probably watching, thinking, why can't you just put A&E back above the door like we had 10, 15 years ago? Because the definition has changed, and with pounds, I think you said, was it a million population you'd be looking into an area to? Well, there would be a substantial investment needed, which is not always about the money, of course, but it's about whether that would meet that demand criteria. Because, of course, every hospital would want. I mean, Lingsbar Hospital in my patch, we would want to be. I love an A&E and else there, but it's about the demand driven. So, just that, if you don't mind, just a bit about that. Is it just that I was just write those figures and that definition, just so we have that clear for public who are watching?
Yes, absolutely. I think everything you said there is absolutely right, Councillor Wheeler. That what an emergency department can do develops year on year, month on month, as technology develops. It needs to be staffed by highly trained clinical professionals. It needs to be able to offer care to adults, children, babies, and that does need a level of skilled staff and physical infrastructure that is only provided on major acute hospital sites. And we do have them on our patch, and those we also we do benefit as a county from having some super specialist services, as Dave said, like mechanical thrombectomy for stroke. That wherever you live in Nottinghamshire, you can get access directly to those services. But you are absolutely right that it isn't health policy, it isn't best clinical practice to provide full emergency departments as they operate now at populations below 1 million without all of that critical infrastructure that sits behind it. We couldn't quantify the cost, but it would be significant, and it isn't a prospect for us in the realistic future.
So to run a full access to emergency department, you do need a coronary care unit, you need a cardiac catheterisation lab, you need a vascular lab, you need critical care, you need intensive care, you need an orthopaedic department, you need a gynecology and obstetric department, you need a set of paediatrics, you need a paediatric ITU, paediatric critical care, you hold a whole vast variety of things for those sickest patients to ensure they've got rapid access should deterioration occur. And that was the issue before, when patients deteriorated in small units, they hadn't got access to the care that was required, and that delay caused poor outcomes. So the figures about new departments are much bigger than existing departments, and there's lots of work to ensure that risks are managed. So the ability to do that around smaller populations is not practical, not only due to the footprint of the unit not being anywhere near big enough. Also, the staffing would require, we wouldn't be able to, because of the shortage of staff, you wouldn't be able to do it, and there wouldn't be the workflow to keep their experience and their expertise up. So there's a whole heap of reasons why full EDs are a much smaller number in the country than they were 20 years ago. What we are committed to do is ensuring the relationship between the urgent treatment centre and the ED is really clear, and we want to work with our population so we can describe those differences. And what we did here when we were listening is that there's still some confusion. A number of people were presenting with essentially emergency conditions to the urgent treatment centre is not what we want, because that creates a delay in their treatment. So we do recognise we need to do more work around not only the opening hours, but actually what's the right sorts of conditions that should go to those two different departments, and how they can use things like 111 and 999 to help differentiate between what is not an easy thing if you're not a trained professional to understand, which is why we've commissioned heavily the use of 111 to ensure that those who aren't sure but don't think it's an emergency can get appropriate triage and signposting as quickly as possible.
Thank you. I think it's always useful when we've got a local member here as well to have the perspective of local people as well with regards to what's going on. I would like to see an A&E department in Newark because of the accessibility, and nothing more what Councillor Lee was saying with regards to trying to go that distance. I think the reality though is very different, and the reality is we're in a situation where the current hospitals that we have don't have the resources to meet the needs, in my own opinion. That we have a situation where primary care access, or to put that in plain English, getting a GP appointment for those people out there is incredibly hard for the majority of people across Nottinghamshire. It's difficult. It's difficult for me to get an appointment for my child because he's now over the 4 years old. So my doctor's surgery treat that different than what he did when he was 2 years old, for example. There are huge issues across our health services that are putting unknown pressures on different departments. So for me, what I want and what is possible at the moment are two very different things, and there needs to be substantial changes that go beyond Nottinghamshire and the ICB and the Sherwood Hospitals Forest Trust to meet the needs of people not only in Newark but across Nottinghamshire with regards to primary care and with regards to how we access A&E and how that is delivered, particularly for our rural communities across Nottinghamshire, because it's just not there at the moment, and there needs to be fundamental changes. Now I could go into a whole list of reasons as to why I think that's not happening, but given that it's PERDA and it's Health Scrutiny Committee, that probably wouldn't be appropriate. But what I will say is I am concerned by what Councillor Lee has said, but I also understand what has been said here before us, and I've been at the other Health Scrutiny Committee meetings where you've spoken before us about what is possible and what isn't possible. What I think would be really, really useful is for the committee and for the public to have that further information that we talked about with regards to the criteria that has been given by government, which has changed significantly by this government, as to what an A&E department has to look like and what those resources are, because that is beyond your control. And I think it's unfair putting that on you when actually that is beyond your control, and that is coming down from somebody else that you don't have control over. And I think that's important that we highlight that. The other thing is, I think with regards to primary care access, we've had GP situation come before us before. Since then, I've been given additional information. I think that's something that needs to come back to Health Scrutiny Committee, given the situation. We can talk about where that is with regards to the work programme. And I think the other situation is with regards to 111. we're often given information that this works really well, I continue to be told very different. And I think we need clarification on how that is working and how this is feeding into this, because that's my other worry, that if there isn't an A&E department that is right round the corner and you can't get the GP access, 111 has to be working. And I know this, and I've said this before, it never works for me, and I don't know if they know it's my number phoning, but it never works for me and my son, ever. I don't get the callbacks, it never works for me. So I would want some clarity on that and how that works for the residents of Newark as well, perhaps particularly. So it's about how those other things are working, particularly in Newark, that you talked about, that all are supposed to be working together, how they are actually working and how they're working together. But I do think that as a scrutiny committee, there is something to be said about us supporting the NHS when they are turning around and saying to us, some of this is actually beyond our control because we don't have the funding for it, we don't have the resources for it, and a national government is telling us what that A&E needs to look like. And I don't think it's helpful having a go at people that are trying actually their best out of a very, very poor and sometimes dire situation in a health service to actually meet the needs of the people in that locality. So I think we need to have some realism about what is really going on around our health services as well. But yeah, 111, can we have a look at that again and have some more information on that? And can we have the communication that goes out to Newark residents, and can we make sure that it is not off the agenda with regards to having an A&E department in Newark? Because whilst you're saying actually to us, if I'm reading it right, what you're saying to us at the moment, you're advising us that it's completely impossible at the moment. Is that right? It's completely impossible at the moment. Well, we've heard from Councillor Lee today what the people of Newark want and what they envisage it. So what needs to happen from national government, locally? What is it that would need to happen to get us to a place where the people in Councillor Lee's, certainly in his ward in Newark, feel more comfortable about what is being delivered at that department? I'm lucky, I live near the City Hospital and the QMC. I can't imagine the thought of driving a long distance with a young child that's very ill or anything. I can't, that's from a personal perspective, but and I have to do it on a fairly regular basis. So I'm really torn, because I hear what he says and I agree. There's part of me that really agrees we need that A&E department, but I also understand how impossible, after all the meetings that we have, how impossible it is. And I'm sorry I'm not being coherent here, but the pressures that you are, and the fact that the realism around it is that you have told us over and over again that this is impossible to deliver as it stands. And I don't think that's you saying that you don't want a department. I think you're actually saying we can't deliver an A&E department as what is expected by this national government.
So thank you again. All your contributions are very helpful and thought-provoking. So it is a National Health Service. Our role as the Integrated Care Board, working with colleagues like Paul at Sherwood Forest, is to deliver local services, locally sensitive services. We do make tremendous efforts to understand our population, both how it is growing in numbers, but also how it is growing in demography, and therefore what that demography might mean in terms of what healthcare needs. Do we have a lot more young families? Do we have a lot more elderly people? And of course, that pattern of demography is different in different parts of the county, and we're always trying to balance that. And Dave has a team of very expert analysts who spend all day, every day, analysing that data and feeding that data to people like me and my teams to say, this is what you need to be looking at, this is where the need is. And it is very different across the county and the city, and you know that. So we do work really hard on that. But you're right, it is a National Health Service. But it's also, we have to work within the available technology, the available workforce, best clinical practice. You know, every day we discover that we can do things that we couldn't do before, and some of those can only be done at a particular scale. So I think, sort of, Councillor Welsh, to reassure you, we do our best to match our resources to the art of the possible to deliver the best care. And we are lucky that in Nottinghamshire, I keep saying this, as well as fabulous local services, we have got some fabulous specialist services that won't be provided everywhere, but that our population can access, and we'll continue to work to do that and to match demand with need, with resources, with expertise, with workforce. So we will keep doing that. And one of the things I was going to say, and you know, Councillor Martin, I think I've talked to you before, we do examine the Newark growth point. There was a sort of set of projections about how the population will grow between, I think it was 2013 and 2033. We keep looking at that, we keep refreshing what that might mean, and we will continue to do that. And one of the things I was going to say, and I am going to come back to this, that I do think the population of Newark really benefits from having the services that Newark Hospital offers. The urgent treatment centre consistently outperforms many other urgent treatment centres in terms of the number of people it sees, treats and sends home within 4 hours. That performance is, I think, consistently the best in our county. So, you know, if you do attend that urgent treatment centre, you will get seen with the appropriate conditions that they can treat. You will get seen, treated and sent home as quickly as possible. And it is fair to say that what the data tells us is that whether you've got an urgent treatment need or an emergency need, it's that speed of response that makes the difference to your outcomes. And similarly, Sherwood Forest Hospitals operates incredibly well in terms of its capacity to see and treat people with emergency needs within that 4 hour window. So we have got great services in that part of Nottinghamshire, and I do think they are, and you know, we do know that the ambulance services is trying its best to ensure that it responds accordingly. So I would just reiterate that whilst this decision may not be welcomed by the population, there is a great pattern of services in that area. 111, Councillor Welsh, should obviously leave it to the chair. Yeah, and of course, and I think you're right, 111 is a regional service, so that's even bigger than us, Councillor Welsh. That's provided across the whole of the East Midlands, and the chair has said before that whilst he recognises it's a regional service, what you want to know is what is 111 doing for the populations of Nottingham and Nottinghamshire, and of course we will come back on that. So, but thank you for your comments.
Thank you, Alexia. I think it's worth saying, you know, most of that point about A&Es, to recap where we work, and I know people might be joining the live stream all the time, which is that nothing's been ruled out, as you say, you know, in terms of when the data is there to demonstrate, it might not just be Newark, might be anywhere in Nottinghamshire, is need for extra service, whether it's A&E, whether it's extra hospital, whether it's extra GP practice, etc. When that criteria is, or the demand is at a point we believe it's needed, it will be dealt with. We always talk about A&E, as we've said before, where there's it's not a case of straight away being able to do it based on the fact just like putting a sign up, because again with the extra staffing resource and not just a lot, and also infrastructure. I mean, I do remember I said it basically would be virtually a rebuild because the footprint of the current hospital would need to be a lot bigger for the diagnostic rooms, etc., and the scale of the buildings there. So it wouldn't, even if it was agreed, you would say but tomorrow, it wouldn't be a case of only opening the day after. It would be a long time because of that need there. So everything's on the constant review. I think it's important to raise that point, Michelle, that, you know, it will need to be kept on review in terms of what facilities are offered. I know that's the case that ICB and NHS do that, and something that welcome that fact nothing's a closed shop. You've got to keep looking at the need, and where it's there, it will be delivered in. So thank you for that. And as I say, like a Blue Peter moment in May, NHS 111, it is coming back, so we can talk about that in the work programme. But absolutely get that point about the 111 service. We need to make sure it's right. So we will touch on that, the other points you raised in the work programme. So thank you very much. Councillor Walmart.
Thank you, Chair. Can I just say that for the first thing is that what I have to say is not personal. I know how hard you all work, and this is a decision that, as far as I'm concerned, I cannot support and will not be supporting. But you say you've listened to the people of Newark. Well, I've looked through the notes and I note the key findings of the listening exercise, and I'm astonished that you've taken no notice to the 70.5% of survey respondents who disagreed that the current opening hours of the service are suitable. They disagreed with that. And a similar view was taken when you heard from public meetings, when visiting community groups. In fact, most of the people you consulted felt that the Newark Hospital should be open 24 hours a day as an accident and emergency department. So I do sympathise with the residents, as Nottingham and Mansfield and Ashfield accident and emergency departments are many miles away and already under extreme pressure. I think you could have helped this situation. I mean, I've been to the waiting rooms in the A&Es in these two departments in Mansfield and Nottingham, and it's been depressing, to say the least. That all these decisions that's being made today are making things worse. But that's why I can't sympathise with the decision. The clinical senate have made the decision. They say that the Newark Hospital should not provide a 24-hour service, and part of the reason is activity levels. Now, how could you possibly make that assumption when the hospital has been closed at night time since 2020? You don't know what the activity exercise would be, or how much use there would be in the hospital if it's not been open for so long. I just wondered how you come to that assumption. It is clear that I'm afraid the Newark residents have been ignored. Now we come to the next steps. As you are continuing with the recommendations from the Clinical Senate, it will need explaining to many pensioners that there is a difference between urgent treatment centres and emergency treatment centres. As to many elderly and people with disabilities and mental health problems, to them they seem the same. As for advertising the facts of the proposal to the general public, make sure that you do let the public know, because most of the public visits libraries, supermarkets and churches, and they must have the information there. As I say, this decision I cannot support. The NHS is struggling at present, and you're putting more pressure on the services at our Queen's Medical Centre in Nottingham and the Kingsmill Centre in Mansfield and Ashfield. I'm not surprised you're not putting it out to public consultation. I do think you know what the result would be. So, Chairman, I'm sorry, but I cannot, in any manner of this decision, can I support. And it's clear, done on a number of reasons, which we will go into at a later date, I'm sure. But I hope this decision will work. That's your words, not mine. But many parts of Newark and the east of Notts will be without, but we're at a loss because of not having a 24-hour service. Thank you, Chairman.
Thanks, Councillor. I think before bringing colleagues in, I think it's just worth saying around listen to and in terms of the hours there. So I think the whole committee and everyone of every party, of everyone, of every council and committee has had a big input in terms of the hours for the urgent treatment centre, because we made clear by a number of colleagues that it needs to be open early in the morning so people are going before work, and more time at the end of the night because people fearing I don't want to get there 5 minutes before I won't be told we're closing 5 minutes. You know, off you go to another hospital, and that hasn't. And obviously, that's been listed with the two changes. So I do think we should place on record, especially for any members probably watching, that this committee has had a big impact in my view, because I've listened to all the comments made while I've been chairman and before that on the items, and they've been reflecting the proposals, which I do welcome. But I do obviously understand the point you make, Councillor, which I know colleagues will address now from SB Lucy.
Yes, thank you, Councillor Wilmot, again for your thoughtful comment. purpose of public consultation is to involve the public in a formal process to consider options for the arrangement of health services where there is a choice that you can implement. We cannot go to public consultation to offer options that we simply can't deliver, and we could not deliver an A&E that was safe and sustainable for the population of Newark Hospital, from Newark Hospital, and that's the reason that we haven't gone to public consultation. Thank you, Councillor Wheeler. You have described that we have listened, we have extended the opening hours critically, we have brought them forward in the morning. We do take really seriously, and I think, Councillor Lee picked it up initially, our duty is to make sure that our population can access services in a way that does not have a differential impact on health inequalities, and that is what we will keep doing, and we will keep doing that, and we will keep refreshing that. And as medical technology changes, as our workforce changes, as our population changes, we will keep going round that loop of saying, we used to do it this way, can we do it that way now? There is a new way of doing it, and that's what we do, and that's what we will continue to do. But we can't go to public consultation to offer something that we simply can't deliver. So I just want you, to truly believe that we do care about the population of Newark. That is why we are working with Sherwood Forest to make sure that where there is national money, for example, for the new operating theatres, for other services that we brought in, we get that new money, and colleagues at Sherwood Forest are really good at taking the money, at building facilities, at recruiting staff, at offering services for the population of Newark. And we will keep doing that. And we will keep doing that informed by insights from people like yourselves. Councillor, if I just do need to say one thing for the record, the Clinical Senate did not make the decision. The Clinical Senate informed the decision, and they are, as I've said, an independent panel of experts who interpret best practice, and they look at our local conditions and they advise. So just to be clear, they were part of the decision making, but the Clinical Senate didn't make the decision. But I sort of do respect and hear everything else that you've said. Thank you.
Thank you, and thank you. I know this has been an absolutely huge piece of work over an awful long time. I'm really glad that there's a permanent solution. To be honest, I was opposed to coming back every year for the temporary, so I'm glad that you've gone down the route of giving us a permanent extension, a permanent decision. Now, I really like data. I'm a sort of data person, and I think looking at the data, I can understand exactly why the decision's been made that you've done. However, I know if you asked anybody, we'd all want a 24-hour service on our doorstep. But I absolutely understand why you've taken the decision you have. I think, looking at the listening exercise, you did say to check whether other ways to access urgent care overnight are working as expected. Can we just have reassurances that they are? Because I know we all have reservations regarding 111, access to GP, out-of-hour services, etc., etc. And also, I know I've asked it before regarding staffing, because I know before when it was just a one shift service, so it was just a 13-hour service, it was one group of staff members, wasn't it? It wasn't overlap, whereas now if we're extending it for the day, it's going to be a different level of contract, I suppose you're going to have to put them in. How have staff reacted to that, and is there anything that you're doing to persuade it? Because I know staffing across the NHS is hard as it is. Thank you.
Ask Paul, obviously, to take the staffing question. Just sorry, Councillor Wilmot, and it relates to your data point, Councillor ID. How do we know what people want when it's been closed? Because we do constantly look at how our populations access care. So patients, we do look at what are the population of Newark, how are they accessing services out of hours, how are they accessing out of hours general practice, how are they accessing 111, how are they accessing the ambulance service. So Councillor Wilmot, we do, and we will continue, we haven't just closed our ears to what happens out of hours. That's all form part of our decision making, and there's a lot of data about that. We've also noticed, just on the data subject, and I think this is a positive thing, since we've been talking about Newark quite so publicly and frequently, attendances at the urgent treatment centre in the daytime seem to have increased, which is good because, as we said, it's a really good place to get care for your urgent treatment needs, and you will get seen quickly. And I think that is a really good result of this process. More people from Newark are using it. Typically 70% of people that use it are Newark patients, and they are still being seen more quickly than many of our other healthcare settings. So sorry, that's the data bit, and just responding to Councillor Wilmot's comment about, well, how do we know what goes on overnight? Paul, let's talk about staff.
Yeah, thank you. Thanks for the question. Staff, when I spoke to staff and talked about the decision, an overwhelming sense of relief that we got certainty, which is the point that you made, Councillor, already, and that certainty. Then inevitably, individuals always think about, so what does it mean to me? And that's where we are. So we're trying to work with our existing staff to have a flexible rota that give them certainty about how it impacts them individually. But it inevitably means that we would have to be a little bit more flexible, maybe do a little bit of recruitment. And just on that, at Sherwood, either at Kingsmill or indeed at Newark or on any of our sites, we do find recruitment in some areas really good. So in terms of our nursing and the type of disciplines of staff that we'll be looking for to staff the additional hours here at Newark, then I think we have a really good track record of that. The issue about the overnight closure and the unavailability of staff was about medical cover overnight being really difficult, not nursing cover. So in terms of nursing cover and medical cover during the day, I feel really confident that we'll be able to fulfil the needs of our existing staff and the additional opening hours that we've heard the decision on.
That's really useful. Thank you. Point you made, Beth. And I think it's also worth, again, because we know that these screenings, all these meetings, some conscious people might be watching the stream for the first time. And one of the points worth raising is when you were open overnight, 24/7, there was around 1 in 3 nights on average that wasn't able to be open because of the lack of medical cover. So
there were got the data to hand, but there were a regular occurrence where we couldn't staff the unit overnight because of medical cover, and therefore we closed, and that divert was in place to Kingsmill.
Much. So next on the list, it's Sarah from Healthwatch. Sarah.
Thank you. Hi, I'm Sarah Collis from Healthwatch Nottingham and Nottinghamshire. For people who don't know us, we work with public and users of health and social care services, looking at how their experience is actually used to improve services. And I guess it's that I want to say. I'm happy to see in some respects that we've got the listening exercise is being actioned, particularly around communications. We knew this was a big issue in terms of people's understanding of the difference between an urgent care and an emergency care, and the fact that we've still got ED signs around Newark pointing people to Newark Hospital. So that's really positive that we've seen that. I think it is really difficult when you've got over 70% of people that you listen to disagreeing with the decision, and then also hearing the clinical sort of rationale being there. So I suppose from a Healthwatch perspective, we want to understand the experience of patients using the service, using the issues around out of hours, because I think, as Councillor Welsh suggested, there are many things that are out of control at local level. Healthwatch nationally understands the crisis, I think, that we're in terms of primary care, and the ability for people to access primary care. And I think Councillor Lee's comments and reflections about what happens in Newark and people turning to the hospital instead of going to GP practices is something I think that the system should really be looking at, and we're interested in that at Healthwatch. We know from the other ED departments, not necessarily Newark, Sherwood Forest, but particularly at NUH, we've got massive issues of people attending inappropriately, and how we support patients to understand where they go and when. That system impact, I think, with the national factors locally, I think is really important for us to all be keeping an eye on, and I know this committee does that very well. So for me, I think continuing to understand the experience of patients coming into Newark Hospital with an urgent issue, and whether or not and how we look at how people can express their experience, whether they've had a good experience or not, further than the friends and family, which quite frankly from a Healthwatch perspective we don't see that as something that gives you robust information about the experience of people within clinical settings. Looking to see, has there been negative impact for people with the out of hours services? Where are the pinch points within those services? We know we've got one coming in May, which is great. You know, from our perspective, GP access, out of hours access, and today there's been something on the news, which was something I was looking at before I came in, around EMAS and waiting times for ambulances. So I think you know, there's a whole issue around the whole system to be monitored, and I think, you know, from our perspective, we'd like to see something that really starts to understand people's experience, and that is used to improve services or to highlight where there are issues you need to take more control of where you can. But to the issue of things that are out of your control, we're seeing that across the entire system, that the impact at the moment on the whole health system is an issue that does need to be looked at from a national perspective, and how that is implemented locally, as we've got such difficult issues across people looking to who do they turn to when they've got an urgent issue, and feeling that whether or not it's a bad experience they've had once, so do they turn to a different service and are not using things consistently. I think that's something Healthwatch would be interested in trying to understand better with you, and bringing the voice of patients to that conversation a bit more.
I'll just pick up the sort of planning bit, and Alex might want to pick up the customer, but the patient experience, which is incredibly important, Sarah. And it's interesting to hear your views about friends and family from a Healthwatch perspective, because that is your space, isn't it? Just to say, I think the friends and family, we get 97% positive responses, so it is an overwhelmingly positive response. I do need to keep saying there's people that use Newark Hospital and its urgent treatment centre really do like it. I think I also acknowledge the complexity of this web of urgent and emergency care services that we're operating within. We do, and it is our role, as I say, it's a National Health Service, but that doesn't mean that we don't. Our responsibility is to make that work locally. And you're right, there are things that we need to make people aware of. So you may ring 111 and you may get booked into the urgent treatment centre. I think it's 13 slots a day. You may ring 111 and you may get booked directly into your GP. People need to understand that, and they need to understand how these bits all work together. But you're absolutely right, that experience of how it feels to people using the urgent treatment centre, which is it's the physical manifestation, isn't it, of urgent care. People understand it. How does that feel, and how does everything else work around them? We need to keep listening, and we've heard some very compelling views, particularly from Councillor Lee, about how it feels to individuals. So of course we want to keep doing that, and we will continue to do our best with what we've got.
Thank you, Lucy. So just to pick up a couple of points there. So Councillor Eddie, your question around how citizens' experience of other out-of-hours urgent care services. I wasn't able to answer at the time because I was desperately trying to dig through a 40-page document, and it turns out the information is on page 39. So, but just to let you know, when we ask people, were your needs met, and the sort of top two boxes of people agreeing or strongly agreeing, they said that their experience of pharmacy out of hours, 69% of people said their needs were met, agree or strongly agree. GP out of hours, 62%, and 111, 59%. So are those brilliant? No, but they're pretty good. So I think we've got a reasonable baseline to kind of work from there. But I think this does come back to what we've been saying all morning, that helping people to understand what you can get from each of those different types of services, how they all interlink, and how people can access them is our task ahead of us now. And Sarah, yeah, just picking up your point, absolutely. Over the next, I think a year or so is what we've been talking about, sort of 12-month review period. What we'll definitely want to be doing is listening really carefully in quite a systematic and quantitative way with our citizens to hear how they're doing. And we've got some ideas on that already, but we'll definitely want to work with you, Sarah, please.
Okay, well, thank you very much. That's all speakers indicated that I've got so far. So thank you very much, everyone, for your participation in the debate. I mean, I understand how passionately high, and it's very much subject for Newark. I think the key thing that's come out of that to me is the communication to residents, because as we talked about, there's been a bit of confusion in the room potential about what services are where, and if we are seeing that, I think residents, I can actually understand Joe Public, who isn't close to how the health service works or runs it. We have to be absolutely clear with them where they get their services and when. So I think the campaign that's being undertaken is really key to that in terms of making sure they absolutely know where their services are, and we continue listening to residents. So I mean, it's also worth just recapping, because again, listen to the debate here. We are not here today to vote to agree the change of the hours, and that's not the in the remit of this committee. We're here to do what we have done, which I'll go for recommendation now, which is to scrutinise the decision made and to give feedback, which I think we have done in abundance now today in the previous meeting. So no one today is voting for or against the new opening hours of the urgent treatment centre proposed for the summer. So just to recap on the three recommendations, kind of for people came in later stages. The recommendations are that we note the attached briefing, which we have done. Consider how best the committee can support communicating the permanent hours of the UTC and information about alternative local urgent and emergency services available, which I think we have done in abundance. I hope you got back clearly what we would like to see happen in terms of communication to residents there, and considered how and when it wishes to receive further updates on the implementation of revised opening times. So as I proposed at the start, I mean, 12 months is a really good base in terms of seeing how that's operated, but what I would also say is when you are ready to implement, when you've got that date, so to speak, as we always at the start, if that can be communicated back to for ourselves, which will cascade to the whole community. And if there are any briefings in that interim where you think that the committee could be worth noting, we don't have to formalise an agenda. We can send that out to said committees so people are looking at it and consider whether we want anything further to come back in that interim. So I think that's really key to say. It's not just a case of we are wash our hands, we're not in the slightest, but it's just about listening to see how this change embeds and the communication that goes out there to the public and how the service is provided. So the recommendation we moved and seconded earlier. All those in favour? Any against? One. Any abstentions? No, so that's carried. Thank you very much. And colleagues, thank you very much for your time today. And or if you can feedback to all your staff in terms of it, we do very much appreciate, I'm sure I speak for everyone on the committee, the work that has been done around your hospital trust to help keep the people in Australia safe. Really much appreciate that with the healthcare done there. And yeah, thank you very much for your time today. Okay, so next item on the agenda, this is where I get to hand over to Bethan, which is just a verbal update on the school readiness panel. So as we know, there's been a subcommittee set up by members of the committee here around school readiness, and the first panel I had last week. So it's been chaired by Councillor Eddy. So I'll hand over to Bethan to give us an update.
Thank you. So we met a couple of weeks ago. I found it quite an interesting first meeting. I think it's going to be a much bigger piece of work than we probably initially thought about. I know we're going to be getting into proper detail of data into the wards in the next couple of meetings, but we'll have the next meeting end of the next month, end of this month, beginning of next month, and we can have a proper look at school readiness by ward divisions, because I think that was the really interesting part of the data that we actually were given at the last meeting. So it should be a really interesting piece of work, but I feel it's going to be an awful lot bigger than we initially thought. Don't know if you've got anything to add.
Yeah, no, I think based on record, the amount of work that was done by the team in terms of presenting, I think was really, it was a long presentation. It was longer than I thought, but it was great because so much information there which we're going through. I think it shows the passion of Irene and her team in terms of wanting to help with the agenda there. But like I say, there's not a quick fix to school readiness in terms of we can put forward a proposal and not be done straight away. But what is helping, I think, this understanding is the complexity of it, and actually it's going to be multi-stranded and people working together across both children and adults and the wider council, because it's not that can be just solved overnight by one or two people. So big piece of work. I think it's really useful that we started that, because as just to recap, there was a lot of information I wasn't aware of, and that there have been many members in the room who have been a lot longer than I have were. So really useful. So thank you everyone who has attended that so far, and if people do want extra information on that, do let us know, because and we will obviously be. Well, Bethan will keep coming back and giving us updates on that, so that's much appreciated. Yeah, and I can just hand over to Noel briefly.
Yeah, I just wanted to add to that just a couple of things really. We within Democratic Services will obviously continue to support the work of that panel. We are working in terms of member availability as well, in terms of the speed in which we can do this, and also the other capacity for issues that we may be asked to deal with in the wider scrutiny function. But we've made a really good start with the first meeting, and I would also just put on record the level of support we got from the specialists within children's services was second to none. It was really good, and it's ongoing as well in terms of the other issues that we're going to be looking at within that particular panel's work. Thank you.
Questions for Bethan or Alison? Yeah, Councillor Wilmot.
Just again to bring up the health and wellbeing provision in Hucknall about the Kevel.
Yeah, we'll get on to the work programme next, John. Don't worry.
Yeah,
we're not on work programme yet. This is just on school readiness, so we'll get on to work programme next.
Sorry.
Okay. So, Councillor Martin.
Have I missed out? Is that a Teams meeting?
It was, yeah. I think that we wait for official nomination from your group.
Oh, right.
Steve Cole's one, but if you, we've still got a vacancy, haven't we, on that one? So if you don't want to be part of that, if you can just, okay. So if we can put David on the list, so for the next one, and we'll get you the information sent to you that Steve will probably have anyway. But the information was sent there, so you can read through. If you have any questions, feel free to. I think let Bethan know absolutely, but feel free to ask us questions, and we can bring you up to speed. No problem. Okay, so any other questions on item 5, school readiness? No? Okay, thank you very much. Don't need to form a vote on that one. I was just vocal update, so thank you, Bethan, for that. So, work programme, to discuss it. So, we've got that in front of us, the updated work programme. Councillor Wilmot, I've got a suspicious feeling.
No, just if we'd heard anything else from the health service about the health and wellbeing provision in Hucknall with the Kevel Centre. It's going on and on and on. You know, it was promised us 3 years ago now, and we even put money into it. The Ashfield District Council put, I think it was £1 million we put in as an available help towards it. I just wondered if we'd heard anything else yet, because it's, as I say, 3 years now, and it's a long time.
Yeah, no, Councillor, I understand completely in terms of why I raised that, and there's nothing official at the moment. Because I did raise it, colleagues, for the meeting. I suspect it might be on a question you'd ask, and rightly so. So there's nothing official at the moment in terms of what's changed from the position we've got. I will ask colleagues if there's any way we can put a briefing to, just so you have that exactly what the position is, and we can discuss if there's anything we can do further. But my feeling is the same as what I said to you, I think, the last meeting before. Until we get everything moved on from HSITB, etc., or the local council in terms of what they want to do vision wise, I don't think there's much that we as a committee to scrutinise at the moment. So we have that decision brought in front of us. I'm just very much conscious that we need that those facts there. So that's okay. Let me speak to colleagues from HITB and see if we can get some information to you on that. Is that okay?
Because, Chairman, it would be nice to get some things sorted out, because with the great news that Hucknall's got £9.2 million in levelling up fund.
Yeah, no, I think just because, especially because we're in Purdah at the moment, I don't know whether anything could be announced even before May the 2nd anyway. I doubt it could because of Purdah, so that's why we need to understand that information first, if anything could be. So I just need to check on that. It's just me making an assumption based on Purdah that they wouldn't be able to make that announcement. So if I can just find that information out, I'll come back to you, John. Is that okay? Thank you. Councillor Martin?
Yeah, I'm interested in the enhanced clinical role for pharmacists and the impact on GP services, because that directly links to me with health inequalities, and I think that's one of the things that we've just been talking about with Newark that is an issue, because obviously they've got very few GP practices, far and few between the scattered array of villages, and that exacerbates the problem on Newark Hospital. And I think Sarah from Healthwatch would agree with that. That's what she was talking about, really. The concentration of how impactful our GP services are, and if they're coping with the strain, and what impact pharmacies will have on relieving some of that pressure, because we've got to remember that GP practices are autonomous businesses in their own right, supported by funding from the NHS, and that's where people get it around the neck.
No, absolutely, and I think from memory, the reason, well, obviously it's on the work programme, but we were waiting because it was obviously quite a recent introduction in terms of change to pharmacy vision. We wanted to see a certain amount of time to see how it worked, because we can scrutinise after 3 or 4 months, but as you know, it won't give us the full picture. So that's what it's on the work programme to do, and we're just waiting for the right opportune moments when there's enough data set to actually be able to give effective scrutiny. So absolutely, it's on the work programme, David. I agree with you. It's something we need to do.
When will an annual?
I think we did say when we were looking around the 12-month period, but I'm happy to be like that. I'm trying to remember, was it about 4 months ago it was officially brought in, the change?
Yeah, something like that.
So it would be around 8 months from now, so probably early next year would be for a 12-month. But if we just to get that initial period of seeing how the service works, I think especially with the change with Newark as well, in terms of that actually probably sitting quite nicely, it could be around 6 months. Assuming it goes ahead as the suggested timescale, Newark, so that'd be interesting to see that data point as well, see the impact that's had with that permanent change.
Yeah, because I was just thinking, if we're reviewing 111 services, obviously we can see how that change is impacting on where they're directing people, because obviously the right service at the right time has an impact on A&E and on everything else.
No, agree. And obviously we've got the 111 coming next month, so obviously everything on that as well. Let's perhaps see how that meeting goes as well in terms of June, yeah. Sorry, not next month, June, getting ahead of myself. I'm not much fun. So June time. So once we've had that in June, then perhaps we can look at from there in terms of because that will also help shape that debate as well, won't it, based on the information we get from there. So that okay, we'll see how that goes there. Okay, great. Michelle, you next.
Yeah, it's just looking forward on the work programme where you've got maternity and 111 on the same meeting. We'll be here for a week. Because 111 is huge, the amount of data that came last time with regards to that, and maternity always has, we always have quite a big conversation with regards to that, in that there's been a lot of progress, is what I'm saying, so I think there'll be a lot of information that they want to share with the committee meeting, and I'm just wondering, could it be halved or shifted around? I'm just thinking we'll be here for hours. I don't mind being here for hours, but I don't think it's conducive. No, what I'm saying looks like I'm being, but I don't think it does justice to what we're discussing. It's not conducive, and that's what I'm trying to say.
That's a fair point, Councillor Welsh, and I think we can take that away and look to recalibrate the next couple of months in a way that lends itself. And one of the things and I'm thinking as I'm speaking here, which isn't always a good idea, but we have the new medical director for NUH coming in July, and perhaps there may be an opportunity for her to attend if we were to shift things around so that we have an early meeting with her. But obviously that's not set up yet, so we can take this away and look to rejig. And just a reminder to the committee that when we get to our first meeting of the 2024-2025 municipal year, we will be revisiting the work programme a bit more substantially and try to plot things forward for the year and look to revisit what's already on there and make decisions as to where we want to focus. And by the sounds of things, if we're talking about whole systems, health whole systems, and we're looking at each of these, like the pharmacies, 111, GP, primary care access, perhaps we could rebadge some of those as being part of the whole look so that we're covering all the bases going forward.
And last but not least, last time we had maternity on here, there was some confusion that caused a bit of an issue, if you remember, Councillor Eddie, with some of the families. We ended up getting, can you remember? I'm not going to go into too many details, but if we can find a way of just notifying the families that it's on the agenda. I think we agreed that last time. It was a different chair, but Councillor Eddie will be able to fill you in, Councillor Wheeler, but we discussed a way we may be able to do that. Thank you. Yeah, thank you.
Councillor Bailey,
Thank you very much, Chairman. I just wonder if it's possible if we could discuss the non-cancer bastard law hospital trust, his most latest CQC report. It went from good to needs improvement.
Yeah.
And obviously, although it covers a bit of South Yorkshire, we do have sites in Nottinghamshire, including Retford Hospital and the District Hospital in Bassetlaw, which also had downgrades in their certain areas there. So I'm just wondering if we could have a discussion.
yeah, absolutely. I think it's absolutely important we have that on the work programme, so we'll get that programmed in, absolutely. Can I say, thanks for sending me that report through. It's something I want to go through in a lot more detail so we can bring that forward. So thank you for that. We'll get all that noted. Nigel, that's turn.
Yeah. Can we add to the programme? So the progress on the new Newgate Medical Centre in Worksop, which was approved and submitted almost 2 years ago, and I understand drawdown on funds. The deadline for that is May this year.
Okay.
So there's not much time left. So can we add that to the work programme, please?
No, I completely agree. I think what we do first of all, we try and get an update more formally in terms of where we're up to that, so we can actually have that in front of us. So we have members, then we'll see how best we want to fit that in. Conscious of the timescale you said, so how we work that into the work programme to scrutinise. So, yeah, no problem at all. Thank you. That service point worth making. Sarah.
Thank you. Yeah, on that point, I know in the past we've had the same team almost that was here this morning talking about primary care and the primary care plan.
Yeah.
And they did mention it just now. And something that I think we're concerned about Healthwatch is that we're not really seeing much improvement yet in terms of, they said there were some improvements, so I'd like to understand what they are, particularly around access. And it comes down to as well where the support they're putting into these private businesses that GP practices are, they're supposed to be putting support in, which again could be answering some of the questions around the development of new services. So I wonder if there's a way in which to have a primary care piece that could then scrutinise some of the issues that you've got generally within the plan. So that's just one thing. The other issue for me is that the next time you've got the mental health trust coming, and I just wanted to inform everybody that Healthwatch did a report on the services that the Nottinghamshire Healthcare Trust did back in November. You can see that on our website, but I would be happy to circulate that. That report was actually then mentioned in the CQC reports, which have been obviously of great concern to all of us, of the seriousness of some of the issues at the Mental Health Trust. And the recommendations that we made as Healthwatch, this is something to sort of introduce to you, is that Healthwatch has got the right statutorily to go into any healthcare setting, which is what we do. And we go in and we look at the experiences of patients. What we found in the services absolutely were then echoed by the CQC report. And we've actually been told that our report got under the skin of the issues in ways that CQC couldn't. So I think it's a really important report for yourselves to read before the next session. But also the recommendations as Healthwatch, unfortunately we were never given any teeth in order to try and make those recommendations happen. So I would be really appreciative if you could consider those in your conversations then at Scrutiny as to how we can add some weight to the recommendations that have come from the experience of patients using the services to the scrutiny that you all provide to this process. So I'm more than happy to send Noel the report for circulation, so you've got that in the round with what will come with the paper from the Healthcare Trust, but also those CQC reports are really quite important reading.
They are, absolutely. No, I've read them, they are. They are. No, I'll go into more detail on that, but no, thanks for that, Sarah. You also appreciate that. We'll make sure that's circulated around if you could, that's Noel. And here's a question about the CQC report going next month. So Nottingham City Healthcare Committee actually discussed CQC at their meeting last week, which Noel attended on behalf. Unfortunately, I was type know a couple of meetings to go to. They don't broadcast online, so unfortunately you can't watch that back. But you will be able to see from their minutes and agenda on their website. And again, perhaps when that's published, we might share that as well, so you can see what our colleagues were looking to from their point of view. Although it's different for us, obviously, with what we can't, I think it's really, really important to look at some of the bits they've gone through. So we'll make sure that's circulated as well. Councillor Lee.
Chairman, just a quick one, and please indulge me on this one, is, as you'll be aware, there's only one mobility centre in Nottingham to do with prosthetics and that sort of mobility to help people be mobile. As we know, there's ongoing conversations at the moment about integrating the service with the Ministry of Defence facility, especially when it comes to prosthetics. I'm wondering if you could have a look into that to see where we're going with that, because we're obviously looking at building an NHS facility attached to the military one that will bring some of the best prosthetics and ability for people to walk and arms and all that sort of great stuff. But it would be good to have them conversations early, because you have to understand that for people in Newark in particular, the nearest facility is the city hospital. And from personal experience, the facilities aren't great. So it might be, because unless you're aware of this sort of thing, it's not a facility that you've probably never seen. And I know have lots of residents in my area with prosthetics and mobility issues that use that facility. So maybe in the future, if you get a chance to look at that.
No, thanks a lot. I think it's really important point to raise there, and I do know with the new facility, because it's kind of falls on my portfolio of Never Council, so I completely agree it's something we need to be looking at. So we'll get some more information on that, look at how we come up for. So thank you very much. Okay, so everyone, I've got my to speak. So is everyone okay with the points we raised today in the work program? So get that all organised, and in our next meeting, or maybe the meeting after, we'll have a bit more detail to flesh the bone in terms of the exact dates to that, or maybe the June one. But it'll come forward in terms of new organised work program. We'll send that round. So all those in favour? Okay, so thank you everyone for your attendance today. It was always much appreciated, and for the level of debate, really appreciate that. And thank you, and I shall see you next month. Thank you. Thank you.